Hello everyone, my name is Terry McConnell. I'm an educator for Alaskan Medical Skincare Systems, as well as an educator for the new line that will be launching soon called Corium Corrective 360. I'm also the owner of Regenesis Skin Studio located in Charlotte, North Carolina. So a couple of weeks ago, I did a video on the Opti Resurfacing treatment, or as some of you may know it as, the Opti Peel. And in that video, we demonstrated doing this treatment with a nano device. So the upcoming video, we're going to now show you how to do this manually with no device. I know a lot of you don't have a nano device, and you needed to know how to utilize this without one. So that's what this video is going to be showing you. If you watch the other video and do have a nano device, I still encourage you to watch this one because there's a lot of good info in this that I didn't share when I did the video a couple of weeks ago. Just some tips and tricks and just things that I think would be really helpful to you guys while you're learning how to use this product. So please watch this even if you watch the other one and do have a nano device. The manual treatment is great. It's a great option. I do encourage you guys, if you don't have a nano device and you want to do this treatment, get a nano device. I think it just really helps to facilitate the whole process, and it really cuts down on the work that you have to do in the treatment. So I encourage that. If you have any questions about purchasing a nano device and what some good ones are, where to purchase and all that stuff, I don't sell them, but I can certainly help guide you there. So please reach out to me. Also, if you have any questions regarding anything in this video, if you haven't ordered yet and you'd like to order, or any information that you may need, please let me know. You can send me a Facebook message, or you can call or text my cell phone number. Happy to share that with you at 704-839-3362. And I hope you enjoy the video. Please watch and learn all you can from this. It's a great video, and I'm here for you if you need me. Thanks so much, you guys. Take care.
Treatment manually, so it's very important. They just do a little bit of the face at one time, and it's hand over hand, just fingertips only, and quick movements. It is not a massage, it is a treatment, but it still feels very nice to the patient. And you just keep working that in. And Liz, how high is your pain level with this?
There's no pain.
Do you feel an icy hot sensation?
Yes. It feels like something's working, but it's not painful. It feels very pleasant.
And then the product, as it bonds to the dead skin cells, becomes tacky. And then when you get to that tacky level, you're going to let that set. You're going to go back, get more product, and you're going to apply your next area. And there's no right or wrong way to move down the face, around the face. You can do whatever's comfortable and natural for you. And then we'll put just a little bit more back on the top. It usually takes about 1 tablespoon per face. Sometimes it's going to take less than 1 tablespoon, depending on how dry or dehydrated the patient's skin is. So the bottle is very cost effective. The treatment cost to you per patient will be approximately $10 on the high side. 5 to 10 is more realistic. And this treatment, you should always charge over $100 or more, depending on your area. Lower income areas, around $100. In our higher areas, such as Beverly Hills, they're charging $350. And you can add this treatment to your dermaplaning, microdermabrasion. You can do this treatment pre-peel. You can do it post-peel, meaning 10 to 14 days post. Another way you're going to know that this is just not product coming off of the skin, you will see a visual change in her skin. She will see and feel how much smoother her skin becomes. This will be everyone's favorite treatment, patient and esthetician. It's just your go-to because you can do so many things with it, and it always gives you that wow factor, that amazing result that people are looking for. Can be done on any ethnic skin, any Fitzpatrick. If it would happen to have too much of an icy hot sensation for someone, we have a hyaluronic or a growth factor serum that we can buffer that down with. If you buffer it, you will not get quite the same peeling effect, but you'll get all the benefit of the Celtic salts and the minerals in here. 82 different trace minerals. Make sure that you do not use too big of a fan brush because that is just a waste of product. You also can do this treatment on any body part. How's your comfort level, Liz?
Comfortable, and I do feel like active.
And I know this looks very easy, but it does take a few times, so please be patient with yourself learning this technique. You absolutely have got to have the right amount of pressure. If you use too much pressure, if you use too much of your hand and you do a massage, the product will go completely down into the skin, and then it cannot bond if you force it all the way down. There are very rare occasions that you will have a patient that has such thick, damaged skin. Literally, you could use the whole bottle and you will not be able to get one flake off of the skin. So if you've done it a layer and possibly you decided to do 2 to try, don't waste your time with a product. Their skin is just too damaged, and we need to move into more of an advanced, complex treatment for them. Make sure when the product is tacky that you do not do any circular movements. It's very important to just go upward, quick, light effleurage, hand over hand. So make sure with this product you stay on the outside of that orbital bone. Now, that was 1 tablespoon of product that we've applied to her face. This is what's left of 1 tablespoon. So there's a lot left. So I'm going to go back and put this on the rest of her face. And then we're going to manipulate it in all over again. So you can see that 1 tablespoon was more than enough for her face. And it's always nice, you always want to go back and do one finishing layer to do the whole face at one time to remove that dead skin. The amount of dead skin will always vary person to person. Some people, younger people, their skin cell turnover time is much quicker. Older people, slower, so you usually get more skin, but there's always exceptions to every rule. This does help you with your extractions. It pulls up congestion on that skin. The Celtic salts acts kind of like an Epsom salts for the body, pulling up impurities in that skin. So it brightens, it hydrates, it exfoliates, all without any trauma to the skin. And again, safe for any Fitzpatrick scale. This treatment can be done depending on the results that you're looking for. It can be done as often as once a week. Most people get it done once a month with their dermaplaning. You can add this into your European facials as your exfoliation part, and it really sets that European facial apart. And we will be having a complete protocol for your European facials with Corium Corrective 360. It's getting really tacky. It's starting to bond. So when it does that, it's a little bit quicker. Fingertips over fingertips. Around the nose like this. And even though this probably looks a little rough or aggressive, it feels very good to the patient. They almost always fall asleep. Another thing that's always fun to do, and we can show you here, the skin's starting to lift up, is if you ever want to compare a treatment to a treatment, do this protocol on half of the face, and on the other half do your microderm. See how the skin looks side by side. I've not done a microdermabrasion in years because this gives such a better result. Can you see that skin lifting up? Looks fabulous. Another thing that will happen with this treatment, people that are heavy makeup wearers, mineral makeup in particular, how it gets down into those pores. When you do this treatment, when you take the skin off like this, what you will see is it's going to look dark brown to you. You will see the makeup just coming right out of their pores. And you just, when you know you're done, is the skin will be very soft and smooth. As long as they're sticky to that skin, you know you still have dead skin to remove. And everybody, it takes a different amount of time. And we did not dermaplane Liz first because a lot of people do not dermaplane, and you can still get just a fabulous result. This is a standalone treatment. Makes their home care so much more effective, getting rid of this buildup. And you also will get a buildup in your own hands, and then you can, it adheres with your traction on the skin. So just wipe your own hands clean of the debris and then go back to it. Support the eyes and lightly massage that away out of the crow's feet. You just have to be patient. It just takes time. Like I said, some people have more than others. So this is just taking a little bit longer, but we're getting lots off, and it's worth it for the result. This product does not have any flour or any corn byproducts in to give you that false feeling of getting skin. And this is about, I think, the third or fourth time I've gone over this area, because the product penetrates down through that epidermis. Sometimes it just, you can just still get more and more off. When you first start booking these treatments, make sure you allow yourself plenty of time until you really have your own technique down, because you want that patient to be so incredibly pleased. You just keep doing this until there's no stick left on that skin. As long as there's stick, as you can see, we keep getting more and more skin. I would encourage everyone, if they do not have a nano device, to get a nano device. You can find nano devices from $99 to $3,900. So all you need is that nano device it does speed the process up. Now you can see her skin starting to get a glow to it. And are you able to relax through this process?
Oh,
Liz?
yeah, I was ready to fall asleep.
Let's see, we're back to that eye now. Look at how much more is going to come off from that eye area. So as you can see, Miss Liz really needed this treatment. She has a lot of dead skin that needed removed. She needed a proper exfoliation. This product does allow, when you remove that dead buildup of skin and other surfactants in the skin, they feel their skin breathe. People forget what their own natural skin should feel like. So I will show you after we cleanse her face when to let them feel their own face, so they can feel that difference of their own skin. And again, more, see, there's still more skin there coming off, but we're almost to completely smooth. And then your hands just slide right all over, no stick left. So I'm going to take and I'm going to cleanse her skin again. I'm going to get some fresh, clean, tepid water. We don't want to put any heat back into that skin. We want to start calming this skin down. We're going to break away now while I change my water, and we will be right back. Now we're going to cleanse. Her face at this point is completely smooth. We've removed all the dead skin buildup. No stickiness left here at all. So now we're going to cleanse. The proper way to cleanse this treatment off is going to be, I prefer 2x4s. You can use whatever you like, as long as it doesn't have anything abrasive in it. Nice, soft, clean water. Clean cotton rounds, clean sponges, whatever you're going to use. Nice, soft. You're going to wipe off the debris. Leave that skin moist, because we're going to go back with the Ultra Creamy Cleanser. And because it's so concentrated, this much, and it takes a lot of water to break that down, and even though that's just that little pea size, even though it's a cream, it's super sudsy. So you want to cleanse that skin on skin. Now that the face is completely dry, and you can use a handheld fan to make sure the skin is dry. We want them to feel their skin for the first time when it's dry, not tacky. So you always test it for them. Okay, Liz, if we could get you to feel your skin and tell us what you think. You can just take your hands and really feel it.
It feels super soft, really, really soft, like a baby's butt. Really super soft. And really clean.
And that's how you do that treatment. Thank you.